Good afternoon, everyone. Today is World Allergy Day, so I would like to shed some light on allergy. Allergies are very common, problematic disorders in skin. When it comes to a person, it becomes very irritable. Patient is not able to work properly, is not able to concentrate in his job, and with lot of problems. He's continuously scratching. Allergies basically is nothing but an increased immunological response to any outward allergen. Any allergen basically is a substance which can cause allergy. So any increased sort of a immunological response causes allergies. And when an allergen comes in the body or it comes in contact with the body, it releases mast cells. It is these mast cells which are responsible for release of histamine, and it is in a way histamine further causes allergic reaction in the body. Some of the reactions may be severe, some of the reactions may be light, and allergies can go on for very long time without getting much relief. So coming to different causes of allergy, there may be various causes like external allergens, like external particles which can give rise to contact dermatitis. Then allergies can be because of atopy. Atopy is nothing but a sort of a genetic constitution where the patient has various patches, dry patches, which tend to flare up with time. They tend to flare up during the humid hours, humid periods, so on and so forth. So when somebody says I have allergy, what do we look for? There are various signs and symptoms which are associated with allergies. These include continuous itching, redness, then there may be appearance of flares, there may be appearance of wheals, then patient may also have itching problem, then he may also have sneezing problem and flu-like symptoms, which include headache, there may be vomiting, there may be diarrhea, and there may be swelling of lips. All these signs and symptoms are related to allergies. Now, how do we diagnose allergy? To diagnose allergy, which may be of various types, like contact dermatitis, we have various tests like prick test. We do patch test for allergies. Then we have various blood tests also. As I already said, the different form of allergies, different modes of allergies. When it comes to contact dermatitis, some patients may come in contact with detergents, or some patients, when coming in contact with perfumes or any harsh metals, can give rise to an allergic reaction in the skin, which can appear in the form of severe itching, irritation, redness, and so on and so forth. So, tests of allergies are various, like complete hemogram with IgE determination can show that how much is the allergy levels and how much the patient is allergic to a particular thing. Prick test is a common test where we have multiple allergens which are put on the arm and on the back, and with the fine needles, sterile needle, we give fine pricks. They are left there for about half an hour, and then you can detect how much is the reaction to that particular antigen which has been put on the skin. So these prick tests, we can definitely determine the contact dermatitis levels, and we can thereby avoid all those substances, harmful allergens which can give rise to allergic reaction. In the same way, we have different other tests also, like patch test is one big test where we put about 100 allergens on the back, leave them there for about 48 hours and read the readings. After 48 hours, what all comes positive is seen in the form of fine reddish papules and erythematous reaction, which comes as positive and which is, again a determinant of allergies. In the same way, we have blood tests where there are about 150 allergens where we give testing. This simple blood test where we draw about 5 ml of blood, and then it is subjected to a lab investigation, and what all allergens are positive can be omitted in the diet. With this, we can determine number of food allergens, we can determine pollen allergens, we can determine dust allergens, so on and so forth. So after coming to the conclusion that a patient has allergies to what all things, those all should be omitted in the diet to make a healthy cure and an early cure of the patient. Now coming to various types of allergies are like one is contact dermatitis, where the patient, when it comes in contact with some harsh substances like hard metals, nickel, and all, it forms an allergic reaction on the skin where patient will experience severe form of itching. Then, apart from this, other form of allergy is urticaria. Urticaria, where allergic reaction in the form of wheals and flares, redness, itching, lip swelling, continues for months together, rather even for years together, without getting much relief. For this, determining of the allergens and stopping them to act on the body definitely is helpful. Uh, Other form of allergy is atopic dermatitis, where there is a genetic factor. Here we find that patient has severe allergies on the skin, where there may be flares during winter season because of the excessive dryness of the skin. There may be ripping of the skin. There may be crusting and even at times bruising on the skin, which also appears in the genetic constituted individuals, commonly seen in children. And for taking care of this atopic part, we have to keep the skin well hydrated. We have to cover the skin with pure cotton clothes, long clothes, because pollens also tend to aggravate this form of atopic dermatitis problem, which is again a very, very irritating skin problem. So hereafter, there are few allergic reactions which are very, very severe. Like Steven-Johnson syndrome is one very severe form of allergic reaction where the entire body may be involved, even the oral cavity may be involved, and at times even eye and genital mucosal involvement is also there. If such a patient lands up, which is most commonly seen because of adverse reaction to drugs, we have to treat it as a medical emergency. We have to give very high doses of antihistamines to prevent histamine release. Along with this, we have to give very high doses of steroids. And at the same time, we have to help the patient by giving topical emollients, topical steroids, so on and so forth. So all these forms of allergies are quite difficult, but however, they are treatable. And if somebody has allergies, we have to give them antihistamines for little longer durations so that gradually the patient's allergic reactions stop building up and patient is relieved of the symptoms. Now coming to a few of the questions, what I can see here. Causes of skin allergy, I have already told you, it may be in the form of contact dermatitis. Contact dermatitis is the allergic reaction to any external constituents, external allergens, which may be in the form of pollens, it may be in the form of perfumes, it may be in the form of detergents, harsh soaps, metals, so on and so forth. So all these things we have to keep in mind when we are looking for an allergy, that what is triggering factor and what is aggravating the allergic reactions. Cold allergy and allergies are quite similar, because if somebody has an allergic reaction, he may manifest with flu-like symptoms, cold-like symptoms. But in cold, if somebody has purely a cold allergy, there he'll have symptoms which are spread over a period of 7 to 8 days. Cold allergic symptoms, they can go on, they can vanish on their own. But if it is a cold induced urticaria, or if it is a allergic reaction where there is release of mast cells, these reactions, they continue for very long time. If somebody has cold, then you should look for the Anki test, where we find mucoid secretions, yellowish secretions, which may not be there in the cold induced urticaria or cold allergic reactions. At the same time, then a cold can also be associated with long time of fever involvement, which may or may not be present in the case of allergic reactions. Commonest type of rashes, I have already told you, they are in the form of wheals. They may be in the form of reddish, small papules spread generally all over the body. They are very itchy. Then, along with that, at times there may be other symptoms like there may be watering of the eyes, there may be diarrhea, there may be vomiting. So, all these forms different type of symptoms for the allergies. Monsoons, in monsoon season, skin allergies definitely are common because in the monsoon there are a lot of pollens in the air, and these pollens they tend to cause different forms of allergies in the body. So monsoons we have to be careful when it comes to the air allergens, and air allergies are again a form of commonest urticarial allergies. We can definitely outgrow allergies by using regular use of antihistamines. If somebody has allergy to heat or ultraviolet rays, wearing of long loose clothes, light colored cotton clothes, using constant sunscreens at frequent intervals, all these things can help you in outgrowing your allergic reactions. If it is related to ultraviolet rays, at the same time, if it is related to oral foods, like some of the foods are which are very notorious, which includes mushrooms, even seafoods, and there's entire list of foods. So if you are able to detect through your allergy test what all foods are harming you, if you avoid them, you can definitely outgrow your allergies. Thank you.